Hi, my name is Amanda Fay, and I am the manager for clinical education and evidence-based practice at the VNH. And we're going to take some time to talk about stroke. Now, what specifically are we going to talk about today? Now, we're going to talk about what is a stroke and why should you care? Why should I care, right? I mean, because when we think about stroke, we have to think about it very personally. How do strokes happen? How can I tell if I'm having a stroke or if someone I love is having a stroke? What can I do if I'm having a stroke or if I notice that someone else is exhibiting signs and symptoms of having a stroke? And what can I do to prevent a stroke from happening? Now, when we think about our brain and we ask ourselves, "So why? Why should I care? Why should you care?" Now, let's get to the brain of the matter. Now, the brain of the matter is that this controls everything. Our brain interprets our world, allows us to breathe, helps us to understand speech, to be able to speak, to be able to move and do what we want. And when we think about when a stroke occurs, then what happens is parts of our brain are affected. Now, if we look at the Broca's area, right, if we think right here, right in this temporal lobe, this is the area when a stroke occurs here, we may not be able to speak. We may not be able to form sentences. We may utter nonsense. Now, when Wernicke's right by our ear is affected, that's where it's the understanding of speech, the ability to take someone else's words and know what they're saying. So every part of our brain matters. And what the biggest thing is understanding that time is brain. So the minute that signs and symptoms of a stroke present, we need to act on that because every second, every minute that goes by, those are brain cells that are dying. So we need to make sure that the minute that a stroke presents, we have we go or we have the people that we love, the other people that we notice are exhibiting these signs and symptoms, go seek help immediately because time is brain. Now, what is a stroke? Now, a stroke occurs when blood supply to part of your brain is interrupted. Either it's blocked or there's a bleed. Now, this can also happen when the blood supply is reduced. So this deprives the brain of oxygen that it so desperately needs to be able to function. Now our brain needs to be fed, and it is fed that oxygen through our blood supply. Now think about your brain and the capillaries, the arteries within it as part of piping. And when your pipes get clogged, the rest of the system does not function. Now, that's the same for our brains. And when we think about what our brains do, when our brains aren't perfused, they don't get the blood and oxygen that they need, those areas of the brain will suffer and that tissue then begins to die. So within minutes of a stroke, brain cells begin to die. Now, why should you care? Responding to symptoms of stroke fast is the difference between recovery and disability. So fast means, you know, not only in speed, the minute that you notice symptoms, but looking at what is in front of you. What do you see? Is someone's face drooping? Is their arm weaker than the other? Are they having difficulty with speech? And calling 911. So acting fast can save brain. Now, someone experiences a stroke every 40 seconds in the United States, which is kind of crazy to think about, but also pretty amazing to know that you may have the ability to affect someone's outcome, to be able to help them save their brain. Now, strokes are the fifth leading cause of death in the United States. Now, remember what I talked about in the brain? Now, there is an area in your brain, if you have a stroke, your breathing is compromised. And so, thinking about acting fast saves brain and saves lives. So how can I tell if someone's having a stroke? So there's facial drooping, uneven or numb. And if you see in this little illustration, this woman's face, half of it is kind of lax, soft. So if you have any suspicions that a loved one or even yourself, you're having a stroke, smile. Have them smile, because what happens is you're testing whether or not their cranial nerves are, their brain is able to respond and lift up. Now, if they're only able to lift up one side, that means that they're exhibiting signs and symptoms of a stroke. And that facial droop is really important to recognize. Arm weakness. Ask them to raise their arms. If they're not able to raise both of them equally, another sign of stroke. And slurred speech. If someone's like really mushing up and they get that mush mouth, or if they're uttering nonsense, that could be a sign of a stroke. And ask them, test it out. Ask them to repeat a simple sentence. I love my cat. I want to go to the grocery store. You know, something simple. And if they're having difficulty doing this, that may be indicative of a stroke. Now, when we think of other signs and symptoms of a stroke, sudden numbness in the face, arm, or leg, sudden confusion, trouble speaking or understanding speech, sudden trouble seeing, sudden trouble walking, they're suddenly dizzy, really, really dizzy, they lose their balance or coordination, or they have sudden severe headaches. And it comes on like gangbusters, like a lightning or thunder, like a thunderbolt, right? So think about and recognize these in yourself and in other people, because these are all symptoms of a stroke. And remember, time is brain. Now, when we think about different types of strokes, there's the ischemic stroke. So we talked about your pipes getting clogged, and this is what an ischemic stroke is, because it's a clot. And so when you think about this clot blocks the blood from coming through and perfusing the brain and giving that brain the oxygen and nutrients that it needs. So the most common type of stroke is ischemic, 87% of cases. It is treatable, but remember, time is brain. We need to make sure that is early recognizable, that you know that something's going on, that you know that the brain is being affected, and then the person can get seen, because there is a short window of time for treatment. And it's generally 4 hours from the onset, recognition of symptoms, to diagnosis, and then treatment. Now, if it's not recognized and treated early, it can lead to disability, either partial or complete. And if it's treated early, it can be, those symptoms can resolve. It's not treated early, the disability and those symptoms will increase with time. Now, hemorrhagic stroke, that's when the pipes burst. That's when, the blood comes out and infuses that brain and marinates it. And that's when that brain is damaged because of the blood, but also that the brain on the other side of that pipe isn't getting the nutrients and oxygen that it needs. So that tissue begins to die. Now, limited treatment, there are some treatment options, and again, needs early diagnosis. And there are about only 13% of cases for hemorrhagic stroke. Now, there are transient ischemic attacks, which are also known as mini strokes. Now, this is a partial occlusion, a partial blockage, and then they resolve. But when someone has experienced these small strokes, they are later have a later likelihood of experiencing more smaller strokes or a larger stroke. Now, what puts you and those you love at risk? So there's some things that you can control, and then there's some things you just can't control. Like the things you can control. You can control your high blood pressure. You can make sure that you take those meds that you need and talk to your loved ones about taking their meds on time, the way that the physician prescribes or their provider prescribes. Smoking. Smoking contributes to strokes, and stopping smoking will increase your likelihood of not having a stroke and also various other disease processes. Diabetes, controlling diabetes, good blood pressure, good blood pressure control, but good blood glucose control is essential. And especially because it affects those, your vascular system. Diet, make sure your diet is low in fat and high in fiber. Or follow a diet that your provider prescribes for you if you have multiple different disease processes. Physical inactivity can lead to stroke, and you have full control over that. Doesn't mean that you have to climb Mount Everest, but do what you can do to keep moving and to keep that blood circulating and reduce the chances of blockage. Now, obesity can lead to strokes. Again, that may be something you have control over. High blood pressure, we talked about that. High blood cholesterol, we talked about a bit of diet. Also, there are medications that your provider can prescribe and that you need to make sure you take. Carotid artery disease, the blockage of your carotids, that is preventable. Diet low in fat, high in fiber, making sure you take your blood pressure medications, peripheral artery disease, and atrial fibrillation. Now, atrial fibrillation, you want to make sure that you adhere to your medication regimen because you want your heart to be able to pump as efficiently and effectively as it can, because if it doesn't, the possibility of having blood pool and make tiny clots becomes higher, and those clots can go to your brain and cause a blockage in those pipes and a stroke. Now, things you can't control. You can't control your age. You can't control your family history. You can't control your race, your gender, and whether or not you've had a prior stroke, right? Because that's just part of your history. So there are things that you can control, and you can help those that you love understand that if they have control over these things, they can prevent a stroke. Now, when you notice these signs and symptoms, and we've already talked about those signs and symptoms, right? Remember, slurred speech, facial droop, dizziness, unstable movement, walking, balance control issues, um, inability to understand speech, inability to talk, sudden changes in vision, sudden headache. When these symptoms are noticed, you need to act fast. You need to call 911. That way, the person that you've noticed this in or in yourself, you can get help fast because time is brain. So what happens after calling 911? Well, you or the person that you love or the person that you've called will go to the emergency room, and they're going to have a full physical exam. They're going to have a history taken because remember, coronary artery disease, carotid artery disease, high blood pressure, diabetes, high cholesterol, all those things the provider will want to know about. And they're going to do a full neurological assessment to be able to assess where this person is functioning. And then the next step is an MRI or a CT scan to, to know what type of stroke it is, because the type of stroke determines the type of treatment. Because if it's an ischemic stroke and those pipes are blocked, they're going to receive a clot buster, and that means that they need frequent monitoring to make sure that they're safe as that occurs. And then that clot buster can break apart that blockage. Now, if it's not an ischemic stroke with a clot, then what they're going to do is they're going to go and and I started talking ahead of myself. They're going to go and clip that leak. Now let's talk a little bit again about ischemic strokes. Now the goal is to get rid of the stroke within 4 hours. Now they're going to remove that clot. And what you see down on the right is a tool that they use to remove that clot. So they could do one of two things: remove the clot or utilize that clot buster. It all depends on the size and location of that blockage. Now, hemorrhagic stroke, right, the bleed, now the goal is to stop that bleeding. You got to clip that leak. Now, it's a surgical procedure, and then the treatment after is really stringent blood pressure control. Got to make sure that that blood pressure stays within a certain limit. Some complications with a stroke. Now, it depends on the brain affected. It depends on the amount of time before the recognition, understanding of the symptoms that are presenting to the treatment. So also previous health status can determine what the complications and outcome will be. And your adherence or your loved ones, right, sticking to the plan, making sure that they stay with the plan, that they stay with taking their meds, going to rehab, making sure that they go forward. Now, sometimes that's hard to do because the individual who has suffered a stroke, they aren't the way they used to be. But there is a way for them to improve and to be compassionate with what they're going through right now. It's a journey. Now, prevention is key. So you want to make sure that you or a loved one have low fat, high fiber diets, or a diet that adheres to your provider's recommendations, given any healthcare considerations that you have. Medication adherence, make sure that you have those anticoagulants, so those blood thinners for atrial fibrillation to prevent those clots. Manage your hypertension, manage your diabetes. Make sure your blood glucose is within normal limits, and get up, get moving. That helps you with your diabetes. That helps with blood pressure. And the brain loves it. It loves being perfused. Quit smoking. That'll help to reduce because what happens with smoking is those pipes get smaller because smoking constricts those pipes. Reduce alcohol intake, and maintain your health. Now, there's some frequent questions that are asked. Can I drive myself to the hospital? That's not recommended. Time is brain, and your brain is compromised if you're having symptoms of a stroke. And if something happened, you could crash the car and seriously harm yourself or seriously harm someone else. So call 911. How much will this cost? Well, that's all dependent on your coverage and early detection. So remember, time is brain. In the minute that you detect early signs and symptoms, go seek help. The minute that you detect early signs and symptoms in a loved one or in someone around, have them seek help. What if I've already had a stroke? Can I get another? The answer is yes. There is a higher likelihood that you could have another stroke. So prevention, adhering to your provider's plan of care for you, making sure that you do all the things to help to prevent that. Is there a vitamin I can take? Well, to prevent a stroke, there isn't one vitamin that you can take, but that's a great question to ask your provider and see what's the latest evidence regarding supplements and how that can help to be integrated into your diet. So I want to thank you so much for being with me. I hope this was helpful, and I want to give thanks to the Geisel School of Medicine's Stroke Action Program. A few of these slides were developed in part by them and the American Heart Association. So thank you so much, and it's been a pleasure. Have a wonderful day.